So I will start with first one, which is what is HIV disease. HIV was identified in 1980 and is from group of viruses called retroviruses. And it is a virus spread through certain body fluids, including blood, genital fluids, and breast milk. This virus attacks the body's immune system, especially the CD4 cells. And these CD4 cells help immune system fight off the infections, and the virus specifically attacks those. And if left untreated, HIV reduces the number of CD4 cells in the body. This damage to the immune system makes it harder and harder for the body to fight off infections and other diseases. So without treatment and care of HIV, a person with HIV is at risk of developing serious infections and cancers that a healthy immune system would fight off. Current treatment of HIV works by reducing the amount of virus in the body so the immune system can work normally. The problem is no effective cure currently exists for HIV. We cannot completely get rid of HIV, but with proper medical care, HIV can be controlled. If people with HIV care take their medications as prescribed, their viral load can become low and it is called undetectable. And if the viral load stays undetectable, people can live long and healthy lives and have effectively no risk of transmitting HIV to any HIV negative partner. So there are 3 stages of HIV disease. Stage 1 is acute HIV infection. This is within 2 to 4 weeks after infected with HIV. People may experience a flu-like illness, which may last for a few weeks. This is body's natural response to virus. In this stage, people have large amount of virus in their blood and are very contagious. In this stage, people may not know they are infected because they may not feel sick right away or at all. So this is I just wrote like if in these cases, if someone visited a doctor or pediatrician office and they got any procedure done there or shared needles for any purpose, shared razors or have sex with any HIV positive person and are feeling sick after with flu-like symptoms, then seek medical care. And this is get HIV diagnostic testing. So stage 2 is called chronic HIV infection. During this stage, HIV virus is still active but reproduces itself at very low levels. People may not have any symptoms or get sick during this time. People not on HIV medication, this period can last a decade or longer, but some progress through this phase very fast. People who are taking medications or treat HIV or ART treatment as prescribed may be in this stage for several decades. And this is what's happening here in USA. People are living very long with HIV disease. And it is important to remember that people can still transmit HIV to others during this phase. So stage 3 is called acquired immunodeficiency syndrome, and this is called AIDS. So we in Pakistan, generally I hear this that everyone has AIDS. We said no, everyone does not have AIDS. Everyone is getting HIV, and if this progress to stage 3, then they will have AIDS. And AIDS is the most severe phase of HIV infection. People with AIDS have such badly damaged immune system that they get an increasing number of severe illnesses called opportunistic infections like TB, RPR, PCP, pneumonia, CMV, and cancers. Without HIV treatment, people with AIDS typically survive about 3 years. Common symptoms of AIDS include chill, fever, sweats, swollen lymph node glands, weakness, and weight loss. Adults are diagnosed with AIDS when their CD4 count drops below 200 cells per mm, or if they develop certain opportunistic infections. And people with AIDS can have a high viral load and they will be very infectious. But for children under 10 years or I think under 14 years old, HIV infection stages are defined very differently. Either you can visit CDC website to see the definitions. Actually, we will include these definitions or discussions in part 3 of our webinar, which is a pediatric HIV. So far, any question?
Yes, Dr. Rizwan, can I say something to my Pakistani friends? So this, we want it to be an interactive session. So I would encourage, if you have any discussion, any point, anything to add or any question, please do ask, because we want to learn from you also that what the needs are, how we can help in future.
And also please guide us if you see any different, which is these theoretical things and what's happening in Pakistan. If there is any difference, please let us know. We would love to hear from you guys. So this slide tells you like very clearly about 3 stages of HIV. If you start from left, this is our CD4 cells before HIV infection. Then someone gets the infection at this stage. Then acute HIV infection happens within like weeks to months. You can see the CD4 means virus is attacking the CD4 cells. After a few months, it can, like what you say, normalize itself, and then it becomes chronic HIV infection, and patient can be in this stage for years. But slowly, this infection attacks all other organs of our body, and at the end, it can develop to AIDS. And very right-hand side, you can see CD4 cells are almost like very low, and virus is there.
So I have been treating Hep C and HIV for a long time, and on these slides, the last slide is AIDS. And the concept in Pakistan is that anybody get HIV virus, they are AIDS. No, it is not. But they are highly infectious still. You see the slides gradually going, and first there was only normal person with CD4 count. Second slide is first infected, and they start killing the CD4 count, and then you go gradually, and the last slide show the tube shows that very highly infected person with a very low immune system, and that is the time people get AIDS. And at that time, CD4 count is only 200 and less.
So, but the good news is this can be controlled very well with the medications available, and HIV medication are really becoming effective with every new medication, and the disease can be controlled very well. And there are 2 known types of HIV. HIV-1 is very common everywhere, and HIV-2 is common in some African countries. So symptoms of HIV infection. They say the symptoms vary from person to person. The only way to be sure if someone has HIV is to have HIV test. We cannot tell from symptoms alone. Then many people have flu-like illness, often called a seroconversion illness. Soon after, they are infected with HIV. Typical symptoms again include fever, sore throat, swollen glands, aches and pains, and blotchy rash. In acute phase, test may be, okay, so this is very important. In acute phase of HIV, this seroconversion illness time, HIV test may be negative, but test should be repeated in a few weeks. So in some people, this illness is so mild that it passes without being noticed. Some people mistake it for the flu, but some people it is more severe and they may need to see a doctor. However, because the symptoms are like symptoms of many other conditions, HIV might not be diagnosed at that time. If someone had a high-risk contact and noticed these symptoms about 2 weeks later, providers might want to consider having an HIV test. After the initial illness, it is not uncommon for people to live with HIV and not to have any symptoms at all, but the virus will still be causing damage to the immune system, and without treatment, most people with HIV will eventually become seriously ill. In late stages of HIV, HIV-related illnesses can cause a wide range of symptoms. These can include fevers and night sweats, high temperature, a cough that won't go away, unexplained weight loss, severe diarrhea, bad headaches, or persistent mouth and skin problems. Of course, these can all have other causes too. In USA and in many countries, the decided found modes are the following, and we would love to hear from Pakistani colleagues if you see any other modes of transmission in Pakistan. So first set of these risks are iatrogenic, and these are doctor-induced. Procedures, shared contaminated needles, or any instrument used by healthcare providers. Then we have shared needles by injected drug users. Shared crack cocaine users, snoring instruments. Blood transfusions, contaminated blood with HIV used for transfusion. Shared contaminated razors within a household. Shared contaminated shaving blades by barbers or beauty parlors. Contaminated or unsterilized instruments used by dentists, and contaminated instruments used by midwives or any other healthcare providers within the hospitals. Then unsafe sex with any HIV positive patients. This includes all MSM and any stage of sex workers. So after that, if you guys can add to the list what you see on the ground there, any other specific risk to Pakistan. We would love to hear from all of you any other risk factors which you have observed in your areas. So one of this is very interesting, and this goes on my mind a lot. What happens during a terrorist attack? Let's say a suicide bomber is HIV positive. What happens there? So I don't know the answer, and I am really looking for any information.
We have few points.
Okay.
Especially the children we are getting in Ratodero, it's the most hub of the HIV in children nowadays. 2 to 5 year children are affected.
Yes.
The transmission from parents, especially mother, is in less number, only 40 number, but maximum number we got from 2 to 5 years, 240 children.
Yes.
So we are searching for it. What is the major reasons? Again, the needle use, disposable use, barbers, pricking of ear, the many things are utilized for multiple purpose. Even same prick through the IV influence. So some people claim that is the reusing of the syringes.
Yeah.
So still we have not confirmed what is really that. But this age group were not expected. We were previously expecting from transmission from mother to child in young age.
Yes.
And the older children are adults who may get with some other causes also. But the group is measured at present is 240, that is 2 to 5 years age.
Yes.
For this, we have to see what is the major reason.
Yeah,
even one doctor is being claimed for this.
Yes.
Yes. Claim for that he was using a same drip to everybody. Similar, the quakes are also using this one syringe to multiple persons. So these are few things we can expect they may be. 100% we confirm we can't say, because there are multiple procedures done. So we have to look for that really.
Yes. Yeah, and this age group is actually, I don't know what happens before the 2 years of age. If children get the vaccinations, immunizations, or at childbirth, the instruments used by midwives, where the delivery happened, and what happened in that.
Yes.
Yeah, so it's all these factors can be contributing the things.
We saw the cases also in our nutrition stabilization center, because these are few cases. 2010 we detected. Routinely we do HIV in every case who is severely acute malnourished. So we got the cases in severe acute malnutrition. This may be the stage 3, 4, 5, because others are screened now because there is general screening. Therefore, many cases have come up. Before that, we on a routine screen in indoor patients on severe malnutrition, we found to be with the HIV. They have no history of transfusion. Their parents were not affected by HIV.
Yeah, so both parents.
Both
Okay,
parents.
yeah.
So both parents are not infected and children are infected.
But then in that case, you should also be looking at the what happened at time of delivery and after that vaccinations. What vaccinations they
Yes.
got, from where they got, what kind of what the injections or anything. You know, Farooq, at this time,
Most of the
blaming
cases,
game.
most
Yeah.
of the cases, most of the cases they receive multiple injections. This was
Yes.
history from outdoor in clinics. This was the major history.
Yes. So, like, we have to, it's good to keep thinking about that and pointing out, because these factors are very important for the communities to know. I think after 2 sessions, we'll be talking about the treatment of pediatric HIV. So let's move on to the next session. So this is the myths and facts about HIV. So please, these are the known facts that HIV cannot be spread through saliva, sweat, tears, casual contacts such as sharing food utensils, towels and bedding, swimming pools, using same telephone sets, toilet seats, biting insects such as mosquitoes or any other, and hugging any person who had the disease. It means please don't stop hugging your children who are HIV positive. And please don't stop hugging your own kids if you are HIV positive. So these are the things we need to talk with our communities and with our patients' families. A shaking hand. All of these things, they do not spread or transmit HIV.
The people at present are actually in shock because this is a big news here. Because
Yes.
previously HIV was not known to the people. They were knowing
Yes.
AIDS just like rare news. But as the
Yeah.
screening has increased the number of HIV cases, therefore
Yeah.
people are in shock. And again, the society is not accepting the HIV children or people
Yes.
positively, because
Yes.
this needs again a continuous counseling. So
Yeah.
the major issue is not only to give the drugs, although previously there was no center for medicine of children here in HIV, that has been started 2 days back. But really the counseling is required for the families also, because the shock is there, because they think like an epidemic, although it was
Yeah.
running under the earth and it is
Yeah.
blasted suddenly on screening.
Yes. Yes. So, this is that's the main reason we started these webinars. We want this knowledge to be spread that HIV can be controlled very well with the medications and with the proper treatment. The only problem is we have to take it forever, but that is fine. Yeah,
So,
and we need to reduce stigma about this, that this is not the death sentence.
more importantly, I would say the how the society and especially healthcare workers
Yeah.
deal with patients with AIDS.
Yes.
I think that one of the goal of our effort is to train in US. As you may see, there's many famous people have AIDS and live for years and years, played basketball and other sports, and be part of a society. So isolating patients with AIDS is not a solution. I mean, that has never happened anywhere in the world. So just have to educate ourselves and our healthcare provider that shaking hands, hugging them, talking to them will not have any impact on
Yes.
spread of AIDS.
Yes.
So those are the important points we have to take. And again, it's a stepwise process. First training is for the healthcare provider or first responders. Then they can go to different cities, different villages, and be part of the discussion as we spread this word in different part of Sindh and other areas of Pakistan.
Very good. Thanks, Rizwan. So let's move to increase awareness within our own healthcare provider group. So when we say healthcare provider, we do not only talk about doctors. These are the doctors, nurses, midwives, and any person working or taking care of patients. So first thing is, please keep yourself, patients, and families calm about HIV disease. And this is very important. This is to reduce the panic, to tell everyone they will be okay if they start using the medication. Second point is treat patient with respect. They did not get it on their own, like on their own, what you say, will. So everyone deserves respect and everyone should be respected, even with HIV or even with AIDS or even irrespective of their any disease.
So I will add right here one thing about the reducing the stigma. Provider, I mean, that is true, primary care, and we give education about this. We have to treat HIV, blood pressure, diabetes, pneumonia, bronchitis, same way. Do not give the look to the patient that he is going to give this disease to everybody. We just have to treat every disease equally and with standard precaution as we always do as a health providers.
And so please be sensitive to the emotions, to your patients, to your friends who are HIV positive, and tell them that you are here to help the patient and families. And as far as we know, HIV treatment is free in Pakistan. So please discuss the options and train your providers. That includes everyone in the hospitals and patients about the optimal treatment. So I just created a few slides. I took it from CDC's website, and these are the do's and don'ts in HIV care. There are a few slides, but not to talk to a HIV positive person. First of all is don't ask, have you learned your lessons? Nobody got it on their will. It happened to them, and it can happen to anyone because the risk factors are such a huge list, and they come from different parts of our lives. Then please do ask, how are you handling it? And this is ensuring, and this is for adults, and this is for even children who are HIV positive. Don't say any other negative thing, but this is how are you handling it? Are you okay? Are you taking your medications? And provide some empathy that you are with them. Then don't ask, so who gave it to you? This is not a question to be asked from the patients, because we deal a lot of HIPAA issues here. If you are asking who gave it to you, it means the patient is giving the information about HIV status of any other person, which is not allowed. And that reminds me, the HIPAA and the issues of confidentiality about these kind of diseases are very important. And we should not be naming the patients. We should not be posting the patients' pictures on any sites or websites or any groups. It is okay to share the pictures of healthcare providers, but not patients at all. And then please do ask, how long have you been dealing with this disease? Not from children, but from adult. And because the adult, they made themselves open with you to discuss about their HIV disease. So just provide them some surety and just open them. They may, after your question, they will open up more. and they will share more of their lifestyle or life situations with you. Then don't ask if your partner is HIV positive, because mostly people, they don't know how they got the HIV. So you are just spreading the fear about partners and just creating problems in their lives. And please do ask, how are you protecting yourself from transmitting? Remember, you are asking from HIV positive patient. So you need to remind them that they need to be careful not to transmit it further. And this can include anything. And going to the doctor, telling about your HIV status, and be vigilant what you are using, and be vigilant within your own household. And please do not ask, will you get AIDS? Because HIV treatment is free in Pakistan. And if I can think like with free treatment, you all can treat your patients well. If a patient is getting their medications, using it regularly, then they will not develop HIV into AIDS. And will you get AIDS question is scary for them, and nobody knows about it. So the thing is, your role is just keep them focused on their regularity of their treatment and keeping them in retention. It means keeping them coming back to your offices as required by protocols there. And if you in next few webinars, we'll discuss more about what is the routine protocol here about pregnant women and HIV children and all others. And do ask, how are you doing with your treatment? And this will give them to start talking about their treatment, what treatment they are taking, how often are they taking, and this is, you can also check how many doses they are missing, and you can just respond clinically to their situation. So any questions, any comments from Pakistan team especially?
So I am Dr. Hussain. On this hand, I will be asking few questions and answering few questions.
Hello, I am Dr. Farooq, working on HIV/AIDS in Ladkana since last 15 years. Before there was the first case in Ladkana registered 1992, where one woman working in a Stages Women Hospital. And then there's outbreak of HIV/AIDS in IV drug users in the about 204.
Yes.
So there are many cases in IV drug users. They are reusing of the syringe. So I many times discuss WHO, and the WHO, UNICEF gave the plan to please do this, make a rehabilitation center. But they all are the file work. But we needs now, but they're out there again, they're in the misuse of the dialysis machines and in nephrology ward. There again outbreak. But you know, only the government have no the sources or other plan to how to control the HIV/AIDS. Then there's again there now this now new again that new outbreak in the children and adults. So we need your support on the case finding, case holding, and health education. We need the BCC, behavior changes support of the patients. We need the safe blood transfusion awareness, and also we need the health education. Now we need the ward. How to make a ward, how to run the ward. We need the education material, and also we need your support for the treatment. Because now we need a ward. But before there no any ward. I went to domestic service to the patient for counseling. But now there are big problem for handling. So we need your support, curative and the preventive, both sides. We look after to you. Please help to support us. Thank you very much.
Farooq, thank you very much for raising these issues. In terms of support, the first step is awareness campaign. Reducing the stigma will do a lot if we do it at every level. Talking to your communities and making some flyers, what to do, what not to do. And if these efforts, they reach to ID users, it can make difference too. Because we cannot put them in the treatment centers by force. We had to teach them what their behavior is doing to them.
Very nice to hear that you are working with AIDS. HIV patient. I will not say AIDS. AIDS is a very advanced disease. How to ward the unit and ward for HIV? I think this is not an airborne infection, or it is not like a TB. TB for you need a real new units, not for the AIDS and HIV. HIV people are admitted in a general ward most of the time in America, and they treated same way all other patients been treated, and without giving them the idea that you have a bad disease. And I have many patients in my office, and I see them as same way I see a blood pressure pill and diabetic patient. We just use the precaution, never repeat a needle. We use our gloves whenever we check a blood test, any kind of blood test. We really in Pakistan, there are so many good organizations. We can start through the mass media teaching, through the small volunteer organization, giving the awareness about this.
We are very aware. There are many campaigns going on there, and we really appreciate this. All the stigma related to HIV should be minimized as soon as possible, so people will not go into panic states. So any NGO, any group working on this, we really appreciate that. And the more, the merrier. Everyone who is hearing it today, you got how the ways, what not does the transmission and what does. So start talking to your patients, communities, and within your own medical students, and hopefully it will help you a lot. So for as long as help in treatment, we need a list of medications which are available to you guys free of cost there. My plan is I will show that list to my groups and my Boston Providence Center for AIDS Research. We have 22 very high level doctors who are treating HIV in USA, and some of them are even creating the standards of HIV treatment. My plan is to interview them, and then we will show those interviews within these webinars, and we will ask you if you have any questions, or some of them are even ready to come on these webinars.
One question about that. One question is that here is the problem is when the patient is diagnosed for HIV, he left the society. There was no awareness about HIV. Another thing is I saw many AIDS cases here, Larkana region. They have the complications, but not be allowed to enter in the ward because they are crying. They probably admit in ward because there are no medicine, no support medicines. So where he admit, we need care and support of the patients. Thank you, madam.
Counseling. We need the counseling before HIV testing and after HIV testing. And in this case, please prepare your own groups, your hospital people to provide counseling. And assure your patients not to panic. This is treatable. And assure your staff too, hospital staff, everyone in the hospital needs to get this education that HIV is treatable. And no one will die with HIV if they start using the ART medication.
TB, tuberculosis, is more infectious than the HIV. Tuberculosis spread through breathing in the air, but not HIV. You have to give this news. This is not spread by staying or hugging and walking and talking with some HIV patient. And now I understand that you just mentioned that you have a few AIDS patients. AIDS mean a late stage of the HIV, which has a complication. Let me tell you, I heard there is treatment available, medicine available, and our providers are not trained well how to administer medication. And AIDS patients get back to normal and just equal to any normal life he can live, and he can live HIV spread. HIV will be there, but he will be treated well. He will not be cured, but this is a chronic disease, just chronic disease like diabetes and hypertension. And Rizwan, you want to add something?
Yes. So Farooq, Dr. Farooq और everyone else, देखिए हमारा सबसे पहला ऑब्जेक्टिव जो इसमें ये था कि इन taboos को, इन गलतफहमियों को, how can we reduce that in healthcare providers? Because those are the first people who interact or encounter with AIDS patient. So if I know that, जैसे Dr. Iftikhar कह रहे हैं और फिजा कह रही है, and I want to emphasize that also, that we should not treat AIDS patient as not part of society, or if something can happen to you if you talk to them, or if you shake hand with them, or if you hug them, because that's not possible. Only way AIDS can be transmitted is by liquid transmission from one person to the other person.
Body fluid.
Yeah.
Body
fluid, right? So unless you're not transmitting body fluid, you're not transmitting AIDS. Unfortunately, this outbreak, as Dr. Farooq has said or Mr. Laghari has said, it's always there. No one was there to look into this and find out how many patients are infected. I think they are, but I would not see that the number of patients will increase dramatically if we control the transmission, if we control, in a sense, to identify the source and make sure that sources or sources are taking precautions कि उसको आगे transmit ना करें. I think, and public को awareness कराना कि अगर घर में किसी को AIDS हो जाए, उसका मतलब ये नहीं है कि आप उसको घर से बाहर निकाल दो, अलग कमरे में कर दो और जो है वो खिड़की से उसको खाना देना शुरू कर दो. I think those type of things should be stopped, should be educated. कि जो है, और हमारा गोल यही है कि पहला we not only can do it in Larkana, but we can do the similar type of seminar throughout Sindh, throughout Pakistan, using same technology. Number two, this will be a stage up type of presentation. Next time we can talk about different modalities of diagnosis. Who is making diagnosis? Are they trustworthy diagnosis? What type of quality control measures are being used for that diagnosis type of thing? And if this is a screening test they're doing or a diagnostic test they're doing, agar diagnostic test ho chuka hai, so then how we are treating that patient. And we can go to government, we have resources जिसमें जो है वो health minister को और दूसरे लोगों को जाके ये data दे सकें कि these are the patients and they need treatment, as you said. So it will be a stepwise process, but we want to know more in the ground that what is happening now and what should be our next focus for next presentation.
I'm a pediatrician in Larkana. I am going to discuss with you the ground reality of the cases which we are receiving in pediatric age group. So you already know that the majority of the cases is from 2 to 5 years of age, and their parents are HIV test negative. Now, most of these children belongs to poor socioeconomic background, less educated. Parents are negative. They are blaming on the doctors, that the doctors are the one they have introduced this virus to our children. Now they are against with us. Even media people are against the doctors because doctors has introduced. So this is a wrong propaganda which is propagated in the community. And that's why we are facing a problem how to treat and manage these cases.
Yes. You know, this is, sorry, thank you very much for this. But this is the fact, this is the main reason we should be talking more about stigma and awareness about HIV. The more people will know about HIV, the more they will be calmed down. And question is, we should try at this time at all levels not to blame anyone. Not to blame any provider, any household member, any parent, no one. Whoever is diagnosed is diagnosed. We should start thinking about what's next. So this is our own groups, all of us together spread this information. And as Rizwan said, that our webinar series is an effort to do that. and we will develop from one webinar to another one. In next webinar, we will discuss different modes of testing, and we will discuss between provider and patients and families relationship. And that will more focus on reducing panel. Yeah.
I am Dr. Manzoor Ali Sumro. Can AIDS develop from single prick of the needle?
Yeah.
Infectious patient.
Okay, and then what happens?
What should be infectious dose?
So let me tell you about the infection. When you have a single prick to the patient and do a blood test and do not use that needle again on anybody.
Yeah.
And always use gloves, wear your gloves, and that needle used for a prick, do not use it again. Needle, can you tell me एक चीज मुझे बताएं, चलो मैं मिक्स करता हूँ कि needles
GPs are using same needle.
हैं जी, बोले?
Usually GPs are using same needle.
GP.
Same injection.
Okay, now this is the also work of epidemiologists to go into every clinic and find out how they are using their needles and why they are using these needles, and find out the workers and teaching. I think there is a deficiency of teaching to these healthcare providers. Not only doctors, it is nurses, it is any health allied personnel.
Here I will suggest one thing. Medical schools जो आप लोगों के area में हैं, अगर they can step up and they can offer 1 day, 2 days refresher courses on these issues and invite every healthcare related person in, whoever is touching the patient, and provide some training, I think that will do a lot more like positive effect. And so please talk to your medical schools or any other organization who is there who can arrange 1 day, whole day training. And you all doctors and in charge of different hospitals, you encourage your colleagues and your employees to go and listen to these workshops. So any idea on this?
Yes.
Yes, madam. As Professor Sifla Jamro and our Professor Shanti Lal highlighted the cases of in the pediatric group, 2 to 5 years, and the local people blame for the general practitioner and some specialists for spreading one. And there's no clear any literature about the infectious dose. Can single prick 2 or 3 before there was a crisis in sharing the needles among the drug users, which were in the nature of repeated use, but there is less chances of repeated use if even at the single prick, 2 prick or 3 prick can spread, as our crisis is the blaming on doctor that they are spreading as specialists, some but mostly the general practitioner.
Okay, so in this case, I will suggest you from your medical schools or from any community organization who is there, prepare a few case managers or social workers who can go and talk to communities. You guys hold some community forums where you talk about this. And I think that can help reduce these blames on doctors. And then the other thing is more important, very often checkups in hospitals and in doctors, who is doing what and where the things are not according to standard precautions. A standard of care should be discussed in our hospitals, in our clinic. I know every Monday morning, every Thursday morning, whole clinic staff meet and they discuss different issues. For half an hour, for 1 hour. Yeah.
Madam, I am working as a senior star with my honorable Professor Sifla Jamro. So I am really thankful for arranging this informative program, because nowadays it's just like outbreak of the measles and diarrhea like gastro HIV. So one thing is very impressive for me that we can admit the HIV patients in the routine wards. This is a good news and great news for us. and so that they cannot be differentiated. This is main thing. So they in future they can be acceptable for the society and for the family as well. So this is really appreciating. My question is that, like my professor, that one of our doctor is under pressure. So why only the doctors are blaming rather than the hajam, barbers, and other drug users? And also, as far as the conditions of Pakistan is concerned, our injections are recycling. Same injections are available in the market after using. So why only doctors are blaming? And madam, this is a useless question for you. That can you help us in releasing the doctor who is a pediatrician as well, because he is not responsible. He just fixed the blame to hide the weaknesses. Hide the weaknesses of the government. So
Dr.
can you
Fiza,
approach the higher authorities?
the problem is because I'm from Larkana, so even I've been away from Larkana since '92, but I know the system. It is easy to blame healthcare professional and scapegoat them and put them in a prison and turn the general public against doctors, then to realize their own shortcomings, their mishandling of the system, and their incompetencies. So this is the system trying to scapegoat healthcare professional, but not looking into their own way of handling and doing a root cause analysis and come up with a positive program so that they can help the patients, they can help the doctors, they can help the healthcare professionals. So that will take a lot of efforts. APNA can help with that to educate the healthcare system and the healthcare department. Rizwan?
Yes. So what I would say, I know there are many problems with this whole project. There's no doubt about it. In many ways, you can handle it. But first step first, we as an educated and concerned people from Pakistan just want to say that how can we help? And we want to work with Jinnah Sindh Medical College University, where Aziz and I am from. And we want to work with the Apna Institute of Public Health, which is a credible organization who can do some research, some help in a sense that epidemiological type of help, which will be hard for us to do. And then we can be an advocate to go and seek for help. But let us do this part first, that how we can educate healthcare providers, how these healthcare providers are making a difference in their local society, and how we can prove them, say that this type of community awareness projects need funding and need medication. And I'm sure that there are many ways we can get medication also. So this is my objective. It is not that we can save someone or get someone, bail out someone. We are not a political organization. We are not. We are just a volunteer, healthcare volunteers. We want to do something good and educational in Pakistan.
थैंक यू रिजवान। और मैं ऐड करना चाहूंगी कि वी आर फ्रॉम पाकिस्तान एंड वी लव आवर कंट्री सो मच, but we also know the taboos and different issues there, and everything has to be done in the right way so to get the right outcomes. So this project is all, we are starting awareness, we want to reduce stigma between healthcare providers and patients and communities. So you all are very integral and important part of this project, and we are really hoping, and Apna, I am sure once we have some more information, Apna will be willing to help you guys too. And Apna is already doing a lot.
This is Dr. Rumana Sangi, the postgraduate student here, working here. Thank you very much for arranging this session for us. My question is regarding the ethical issues in treating the HIV patients. As you correctly said that we should not make any stigmata or discriminate these HIV patients in treating them, and we should treat them in the general wards. But as you know, the current situations which people are dealing, especially we doctors and we students, that if we is there can we label them, or can we make a different separate word for them, if because most of the patients, most of their attendants, and most of our staffs yet are not being that much sensitized for these patients. So anyone can get infection of not knowing them that the patient is HIV positive. So should we can take these measures for a certain period of time by labeling these patients as an HIV positive, in order to just stopping or just not spreading the infection to the people who are not aware of that, till we create and such a kind of a huge awareness in our community, in our staff, or the people who are related to the health professions. So we are finding these problems in dealing with this HIV patient. So currently, can we go in this way that we should label these HIV patients is they are HIV positive. So because of lack of so many facilities over here, we cannot treat them like as a simple patient of diabetes or hypertensive or TB, because as far as we cannot label them, we find so much difficulties, and most of the people are being missed, and being other people are getting the infection as well. So in this regard, if you can help us, then how to treat this, how to face this challenge in our community, because we are dealing with very poor socioeconomic status people, especially the patients are belonging to those areas, and they are not that much aware, and they are not so much easy to get counseled. So we do find these difficulties. If you can help us in this, so we can for a time being the community can get sensitized with this, we can label them, because we have to save ourselves, our health professionals as well, our staff, and the other people as well. Thank you very much.
So that was the actually I will give this question 5-star question, and the best question we really want to answer. And Rizwan, you will follow up this answer also with this. Number one, this is the question of a student who is directly taking care of patients, all kind of patients in the hospital. Let me tell you, you have to have extra precaution in people with tuberculosis and flu patients. You do not have to be extraordinary precautionary with the HIV patient. With AIDS patient, they can have a TB. They are infectious. They may need short-lived isolation, and it all depends on the CD4 count. If somebody have a CD4 count over 200, you do not need extraordinary precaution. You just need a standard precaution. Put on your gloves and do whatever you want to do a blood work. But just simple handshaking and hugging and using common utensil, you will not get HIV. This is spread only and only sharing body fluids going from one person to other person, not airborne infection. TB and flu is airborne question. Now, next question comes, you ask how to train your staff. I think I did get a very nice follow-up from the staff who work with some professor asking that patient worried how to put them isolation or not. Standard precaution, if somebody have a TB, tuberculosis, they need a precaution. That is airborne infection. Flu is airborne infection. There are few more, mostly, and not the HIV. Do not label HIV as AIDS. If somebody starts losing weight, they have a cough, pneumonia, or serious illness, that is AIDS. In that situation, still, if somebody have a TB, that need a precaution. But the Rizwan, I think your question comes and with the awareness. You have all professors there, very senior doctors. I am internist. I used to work in Brown University Hospital and take care of HIV patient. My office, I have a Hep C and HIV patient. We never make a difference. We just use our gloves and never repeat a needle and just normally treat all kind of patient. The only education starts in your school, college, from students, from the lectures. Just allocate 1 or 2 hours in the college where every student is there and tell them what is HIV and how to not to stigmatize this in the community. Rizwan, do you want to add
Yes.
something?
So, right. So what I want to add, as I'm saying, multiple time it's been repeated, okay, let's ask questions. Someone asked about, can you get an infection by one time needle exposure? So the answer is, if it's contaminated and if it is enough dose, so yes, you should be prepared to for example, if healthcare provider get needle prick of an AIDS patient, for example, right? Yes, that person should be monitored. Most of the time, you do not get infection by one prick, but that doesn't mean that person who got pricked should not be monitored.
That's very important to wear the gloves.
Right. Number two said repeat use of the same infected needle will certainly get you infection. So that's what happened with drug abuse patients, for example, that they keep using same needles again and again, and that's where they get infection. Then repeat sexual encounter with infected person. Repeat, I said, and without protection. Yes, that will cause air infection, but not if you're doing it with precautions and if it's only one time of encounter. Most of the time, it doesn't happen. And there is no fluid transfer, no body fluid transfer. There is no infection. There is no transmission. So those type of awareness things are the first thing to do with the healthcare provider. So when these patient comes to you, so it's very easy to put them in a separate room, for example. But is that the right way to treat the AIDS patient? No one treats treats that AIDS patient anywhere in the United States or anywhere in the world like that. They don't put them in isolation. They keep them part of a school, for example. All these AIDS kids, they go to regular school and no one get infection as long as there's no body fluid exchange between the two, infected and non-infected. So these are the important points to remember. And again, our goal is not to change the political system or government, that this government is not doing something, so let's bring someone else. No, that's not our job. Our job is to provide help at the healthcare level and as a volunteer and as places where we can make some difference.
So,
Assalamu alaikum, it's Dr. Aarti, postgraduate trainee. I want to ask the question, can HIV spread through the wounds, like the surgical wounds or other wounds of the body?
Yes, of course, if it is like if the wound is open and if someone is using the contaminated needles again or contaminated surgical instrument.
Not by changing the dressing. It will not. Even if you get blood touched from HIV just on your hands, you will not get HIV unless you have the open wound and accidentally you touch a blood with the hand, you will not get HIV. And you have to use precaution when you putting the dressing on the wound and clean up prop and with the gloves on.
Sure.
I have a final question as a Professor Saifullah Jamro, because we are facing many problems. This is just not HIV.
Yes.
As we asked about, there are 3 conditions where we get HIV. One is that severely malnourished immunocompromised patients. When we have a screening, we get HIV. So another is the thing, patients are coming with the tuberculosis in children with HIV.
Yes.
So these are 2 major things. And another important point is the same route. The patients are also coming with HIV with hepatitis B and C. Can you put some points on that? How to manage the hepatitis B, C with HIV, how to manage severe malnutrition with HIV, tuberculosis with HIV. Because young doctors are there who are in clinic yet started new. They want to have a problem in the dosing and adjusting the drugs.
So that's another very important question as a clinician. And ये जो जब co-infection, we call this co-infection. अगर जब किसी को co-infection होता है, then we have to have a different combination of treatment for Hep C. क्योंकि in certain जो है HIV को treat कर रहे होते हैं, if they have Hep B or Hep C, they can reactivate it with that treatment. The combination treatment for a co-infection is different. This is another topic we will be having interview, and this is a really good question. We are going to have interview with the expert. Actually, they are number 1 or 2 in the world, HIV specialist. We are going to have interview, and we will be talking about the treatment and interviewing them, recording them, and how to treat if a co-infected patient. What are the combination of treatment we are going to treat? And मेरे भाई, let me tell you, यहाँ जो HIV लोग जो हैं आज से 20-30 साल पहले पॉजिटिव थे, अब वो जो है 80 ईयर और 90 ईयर हैं, they are living normal life. Nobody dying with AIDS or HIV in America. And nobody spreading HIV/AIDS through sexual contact if they are totally suppressed, if they are undetectable and stable on the treatment. There was a time.
No, parents are asking from us, suppose 2-5 years old child, parents are asking from us, with good treatment, how long they can live?
Forever. Normal, just like normal people. And with the treatment, yes, they will live. Yes.
But you have to explain to them that the condition is they have to continuously use your medications. And with medication, people are living as normal life as HIV negative people.
So it's, let me put it in a different way, right? It's like a glass full of water, right? If you know that if glass is half full, you will not get AIDS. So if you keep, same thing is about AIDS. If the virus is always there, for example, but if it's not above certain limit, it will, person can live a normal life. And of course, nutritional conditions are very important in that patient. Autoimmunity is very important in that patient. But as Fiza has mentioned, that unless the T cell numbers go down certain level, unless viral load is above certain level, this is not a disease which should be treated as an emergency. Yes, you can live a normal life. You have to keep monitoring your viral load testing and T cell counts.
Yeah, and yeah, people die with complications who are not treated. Once somebody diagnosed with AIDS, they can have a complex infection, but with the treatment that can reverse and infection goes away with the immune system when people build up with the treatment. CD4 count goes over 200. Many times the PCP, this is a pneumonia prophylaxis we take off, remove it if CD4 count goes over 200.
But this is only for adults, CD4 200.
But for the children,
yeah, for the children,
we have different
HIV definitions AIDS definitions are different, and I think we will be discussing that in next webinar. Any other questions from Pakistan? Okay, actually our next webinar will be how to test for HIV diagnosis and what are the HIV disease management tests that include CD4, viral load, different limits, different scenarios. So the webinar after that will be how to take care of pregnant women who are HIV positive. Then the next one will be how to take care of children who are HIV positive. So we will be joined or we'll be showing you the interviews from the very top healthcare providers in those fields. But for that, we need this help that what are the medications available to you guys there for your HIV pregnant woman or any HIV positive patient. If you guys kindly send me a list of medications, we will use that list to interview our specialist.
So Fiza, what I suggest that we can, you remember you mentioned that you need a questionnaire to be answered. Let's develop that questionnaire and send it via email to Dr. Farooq and others and ask them to email us back so we can have some background knowledge to let's see what we need to talk next. I think we also need to talk about treatment options and diagnostic modalities, like what is the best way to diagnose and monitor this.
I am Dr. Fan. I'm the in charge of the pediatric HIV practice in PITS children. So I am thankful to Dr. Saifullah who they arranged this regard of the some of the teaching about HIV. So I have the one of the question. We have the lot of the patients of the children. So here the regimens are the different in the way of the treat to the patients. Here the medications are the regimens in the form of the different type of the regimens. So we have the collectively not complete of the regimens who the treat the all kind of the patient. Suppose of the came in with the hepatic co-infection, some of the malnutrition, some of the having the another the co-infections. So how will they treat the in the medication with the regimens? We have the only the two form of the regimens. So please tell me the what the kind of the help for the
yeah, that's those regimens are HIV like medications, and the provider they have to see different combinations. Means if you can send me the names of those tablets or regimens, we will show that to our the specialist here, and we will discuss that with the different a few specialists, and then we can answer you that question.
Also, we need the co-infection. What is the rate of co-infection in the same patient? For example, if somebody have a TB, a child with TB will need a different combination of treatment than people without the tuberculosis. A person with the hepatitis C or hepatitis B will need a different treatment as compared to people who have only HIV. So anybody who has HIV virus in the body, anybody, low level or high level, everybody need a treatment to go on treatment. Even if they are symptomatic or non-symptomatic, they need a treatment.
So we are not only the depend upon the CD4 or the depend upon the symptomatic when the patient are become in the stage 3. Can we start with the symptomatic the stage 3? We can start the medication or they depend upon the CD4 report.
Yes, you can start anybody. Symptom may be from flu, symptom may be from somewhere else, but if they are HIV positive, start the treatment. What about how many people get the viral load, HIV viral load? Do you have the
why
facility
are we depend
to
upon
check
the
it?
only they start with the here
Yes,
here there no any facility about the CD4. Even the same condition came from the another the rural area. Here the huge amount of the patients we came they came from the rural area. Here the here we want to the one of the huge setup from the here in hospital. We want to the more of the admission patient in the ward. So we can you help the we can provide the one of the huge setup in the pediatric peds medicine. So please tell me. So.
Yeah. Rizwan, I was thinking, and Aziz and Farooq are in the HIV. So we just really want to know if a World Health Organization, I think, is sending a treatment free of charge, and that this question is really good. Without any CD4 and HIV diagnosis, CD4 and no viral load, but HIV positive and symptomatic, yes, we should start treatment. We should not wait until we get the CD4 and HIV level. But we have to need to know if that maybe a person is also have a hepatitis B or not, or that is the most commonly spread vertically. Hepatitis C usually in later stages. It is not spread during the delivery system. Hepatitis B spread by that, and if they are HIV positive, and I think, I guess we should start treatment if they are positive for HIV.
So we
Do
are
you
the not
understand?
only the depend upon the CD4 or the depend upon the symptomatic when the patient are become in the stage 3. Can we start with the symptomatic the stage 3? We can start the medication or the depend upon the CD4 report.
Yes, you can start anybody. Symptom may be from flu, symptom may be from somewhere else, but if they are HIV positive, start the treatment. What about how many people get the viral load, HIV viral load? Do you
So
have the
why are we
facility
depend
to
upon
check
the
HIV?
only the start with the here
Yes, go
there
ahead.
no any facility about the CD4. Even the same condition came from the another the rural area. Here the huge amount of the patients we came they came from the rural area. Here the here we want to the one of the huge setup from the here in hospital. We want to the more of the admission patient in the ward. So we can you help the we can provide the one of the huge setup in the pediatric peds medicine. So please tell me so.
Yeah. Rizwan, I was thinking, and Aziz and Farooq are in the HIV. So we just really want to know if a World Health Organization, I think, is sending a treatment free of charge, and that this question is really good. Without any CD4 and HIV diagnosis, CD4 and no viral load, but HIV positive and symptomatic, yes, we should start treatment. We should not wait until we get the CD4 and HIV level. But we have to need to know if that maybe a person is also have a hepatitis B or not, or that is the most commonly spread vertically. Hepatitis C usually in later stages. It is not spread during the delivery system. Hepatitis B spread by that, and if they are HIV positive, and I think I guess we should start treatment if they are positive for HIV.
One thing I want to add, just like in this, that you have a PCR lab in Larkana, and you can go and just send to the patient and just know the viral load of the patient, then you can determine, the CD4 load and can start the treatment. So I think it's just not like that we don't have the facilities. We have to articulate and just make the services coherent, that we can treat the patients. We have molecular lab in Larkana. It's very easy, just go send the patient. It's very common. You can get just like PCR done of patient to know the virulence load. I think it's just a little bit training is needed in this regard, as you are doing a good job by training them. I think probably they will just like get a lot of input from this, and they can just like set up some protocols of their treatment.
Thank you very much, and that's what our main purpose is, to introduce and to start talking about this issue.
I'm Dr. Farooq. So I'm telling about the pregnant women. I'm telling about the pregnant women which are diagnosed with HIV positive in Larkana. 95 pregnant ladies, only one hospital, ladies hospital, Sheikh Zayed Women Hospital, diagnosed with HIV positive.
Yes.
Yeah?
Okay.
Another thing is many other cases. I find when I was working in the medical center to watch the blood transfusion. Before there are no image about the 5 diseases to screen from the blood. There is syphilis, HIV, or malaria, hepatitis B, C. But directly only blood group they are introduced. They inject the blood to the female humans. Even I close one laboratory in Larkana. They claim that we are for the thalassemia people working for the free of cost. When I check the blood from their refrigerators, we can find many infected HIV positive blood bags.
Wow.
Then say to me, Doctor, why you are claiming to us, blaming to us? You know that thalassemia people are going to die. So no problem. The reply of the peoples here, Larkana. Even
This is a lack of
many,
education. This is the thing we have to address and
lack
educate,
of
you know.
education, lack of awareness. Even I saw here many patients HIV diagnosis as HIV positive. They refuse from the society. They pick the blood in the syringe in the road. They say, give me the money. Give me the money. And if not give you money, I enjoy the blood of the HIV. I saw many cases here. So we need the care and support and the and the safe blood transfusion and awareness of the people and patients and health care peoples.
Right.
Thank you
So
very much for your kindness.
I totally understand your passion and of course the frustration, and of course there should be a coordinated effort to educate and diagnose and treat, and we will go towards that. But today we are about half an hour over the time limit of our people, so we will regroup again. If this is a good time, let's meet up again next Sunday, same time,
same time, yes.
same thing, and go to the next step. But we will send you a questionnaire. We have to fill those questionnaire out, as many as possible, and give us back. So next time we'll talk about diagnosis and some treatment option also. So with that said, if no one has anything else to add, we want to say Khuda Hafiz and have let's meet up again and communicate on email.
Let me say thank you very much, everyone, to give time. We really appreciate that.
Yeah, let me close and give my remarks, and just like, please don't find the faults in each other. Just try to help the people who are just really affected and infected. Don't try to find the faults.
Yes.
Yes,
Yeah,
that's
it's
what
not
we
time
are
to find the
trying
faults.
to do. Yes.
Wonderful.
No
Thank
blaming
you
at
so
all.
much.
Yeah.
With that said, I'm going to log off.
Thank you very much. Thanks, everyone.